Hello, everybody, and welcome to our Wednesday bi-weekly coffee chat with elder care attorney Rob Slutsky. We're happy to have our guest speaker today. We have Kate Callahan joining us from Mercy Life, and she's going to show and tell us a lot about Mercy Life so that we can answer some of the questions that we might have and perhaps learn a lot of new things that we can share with other people and be a better resource to people in our community and families that we're assisting. So hello, Kate.
Hello, thank you so much for having me. I'm very excited to get to be here today. I'm going to share my screen. All right. All right. Let me get to the top. Great. So I'm really excited to be here today because, Mercy Life has been in the community for some time. A little bit about me, I've worked for Mercy Home Health for 5 years prior to coming over to Life. I started with Life a year ago, just in time for the pandemic. So it's been an interesting year. But one of the things that I found in that year is really how little people know about us. I find a lot of people that are right in our community, right where we are based, have never heard of us, or if they do know, and we start kind of like, oh, I know about Mercy Life. And then we start diving into it. I find out that they actually don't really have a full understanding of what the program is. So I'm really excited to have the opportunity today to share this with you all so you can add it to your list of resources for your seniors in the community. So LIFE stands for Living Independently for Elders. And our goal is we're referred to as a nursing home prevention program, also aging in place, and continuing care. So there are all different ways that we use to describe the Mercy Life program. Our goal is to help seniors stay in the community, active, healthy, and thriving, and stay independently for as long as they can. So our main goal is little to no decline in their health. So we do that by adding our support services to them. This way they can stay in the community and out of long-term placement. There's that kind of that gray area between like, oh, mom and dad needs help, but they don't necessarily need to go into a nursing home yet. So that's a good time for us to step in. Mercy Life is part of the National PACE program, which stands for Program of All-Inclusive Care for the Elderly. That is a national Medicare managed care organization. When PACE came to Pennsylvania, the acronym LIFE was already in use. The acronym PACE was already in use. So that's why it's called LIFE over here. And I've noticed that a lot of the Northeast range refers to programs as LIFE programs. So you might hear LIFE and PACE interchangeably. It actually started in San Francisco in 1971. It came to Mercy Health System, opened ours here in 1998. So we've been around for a while. It's been a little long time now. There is 122 programs in 31 states with 272 centers and over 50,000 participants. So, a lot of people are being helped by our services. You personally might be familiar with the LIFE program because we are part of the aging waiver. So somebody applies for Medicaid and they're eligible for aging waiver. They have the option of the waiver program, or they can come to the Mercy Life program. The things that I think make Mercy Life special and different is the fact that we're mission driven, we're community based, and we provide fully comprehensive care. So pictured here is Catherine Mccauley and the Sisters of Mercy. Catherine Mccauley founded the Sisters of Mercy in Dublin, Ireland in 1831. They came to Philadelphia in 1861, and they founded Misericordia Hospital in 1918. Which we know now today as Mercy Philadelphia Hospital. She started the Sisters of Mercy with the intention of providing healthcare services to the poor and disadvantaged. We have held that mission true up through till today. Prior to my coming over to Life, I was please excuse the train, I apologize. Before coming to Life, I was the executive assistant to the leadership team over with Mercy Life and Mercy Home Health. And at the beginning of every meeting, at the end of every meeting, and throughout it, our mission and core values is really the basis of everything that we do. I'm really proud to work here because it's true. Like, we are very mission driven. We're also community based. So our centers are in the hub of the communities we aim to serve. One of the neat things about my position is Traditionally liaisons will work with hospitals or rehabs, which is true for me as well, but I also get to really get out in the community. So I work with a lot of faith-based organizations, the different food pantries, pretty much anything in the community that aims to serve, a senior population. We try to get in there, and help out and make sure that we're part of that conversation. And it's fully comprehensive. So one of the participants said to me one time, Mercy Life is a one-stop shop. And I use that all the time now because it's really true. We cover the full spectrum of care for our participants. I'm going to dive into this a little bit more individually. This just gives you a brief overview. When I say fully comprehensive care, all of these things are included and provided by Mercy Life with no co-pays, no patient costs whatsoever. And we have a very extensive provider network that is continuing to grow. So this is what we refer to as our interdisciplinary team. So what I'd like you to do is picture our Mercy Life participant and their family in the middle of this circle. And this is their care team. So each Mercy Life program is personalized to the care needs of the participant. So our IDD team, which is what we refer to them as, will devise that care plan specifically for our participant. Our team meets every single morning and they discuss our participants. So all of these people are on the same call. They used to be in person and they know our participants so well. So I don't know about you, but for the idea of all of my care providers being in one room talking about my care is just not something that I would ever think of. So it's pretty unique that all of these people are discussing the progress and the potential and maybe any setbacks. So if Mrs. Jones has a fall in the home, she's not just, a name on a file. She's not an insurance number. She's Mrs. Jones and we know her. So why did she have the fall? Well, what is going on? What can we do to make sure that that doesn't happen again? So each of these people is designed specifically towards that person and they get to know their care team really well. So it's not just, anybody, they know, Sally, their nurse really well and they get very comfortable. So these are the medical services that are covered by and for, by Mercy Life. They have a primary care doctor. One of the things that's really unique to Mercy Life is we make sure our participants come in to see the doctor once a month. So it's actually one of the only stipulations about the program. It's a very, it is what you want to make it kind of program, but they do have to come in to see the doctor every month. And we do that because we want to make sure that we're laying eyes on them, whether or not they're sick. Because again, the goal is little to no decline in their health. So this gives us the opportunity to see them, catch anything that might be happening. And then if they're not feeling well, let's say it's a Wednesday and they're not feeling well, they have the opportunity to call us and we have a 2-hour window to provide transportation for them and get them in to see the doctor. So again, in my own experience, the idea of seeing a doctor the same day that I need one is just kind of unheard of. So it's pretty special that they can see a doctor the same day that they need to see one. We provide nursing care. All of their medications are included and shipped to the home, and we assist with med management, physical occupational speech therapy, dental vision, hearing, podiatry. All of their medical equipment is provided for, and we make sure, for instance, I've worked with people who, the population we aim to serve is low income seniors. So I will work with people that aren't taking their medication because they can't afford it. They're choosing to eat, to pay rent over choosing their medications. Or I've worked with people who need a cane or a walker or a wheelchair, and they're using one they got, off the street, a used one somebody had laying around, and using that kind of improper equipment can actually do more damage than it's helping. So with Mercy Life, all of that is provided for them. We get it to them. That also includes hearing aids, eyeglasses, dentures, any of the equipment that they need, we pay for them and we get it to them. A personal emergency response system, like a life alert, mental health services. If the need for hospitalizations and nursing home care should arise, we pay for that as well. Part of that personalized care team that everybody has is their social worker. The social worker falls in kind of like a case manager. So they provide a lot of services to our participants. They've become one of the closest people to our participants. And while the participant's the person we aim to serve, we also are helping the family. So we provide counseling. We have caregiver support groups that our social workers run. We provide education for them. We also try to be a beacon of truth for our participants. So we offer a lot of education about scams that are happening, especially right now with COVID. We've made sure that they are up to date on what to trust, what not to trust, especially the misinformation that's been out there. We help with financial management. And then the social worker also is really well versed in the available resources in that community. So if Mrs. Jones is eligible for Meals on Wheels, the social worker is going to make sure that she's getting all of the services that she is eligible for. We also have a spiritual counselor. We have a chaplain on staff, and then our mission director is very involved as well. So we do one-on-one spiritual counseling that's been extremely helpful through the pandemic for our participants. We also have group calls as well for prayer or, just for some counseling. And then we have elder law people we partner with too, who will provide free legal support. To help our seniors stay independent, stay in the community and thriving, we do some supportive services as well. So when our center is open, we provide breakfast and hot lunch, but we also will send meals home if it's appropriate as well, if we think there's a need for that. Through the pandemic, we've been doing meals for our participants since they can't come into the center. We provide light housekeeping, laundry, cooking. We have an aide that will help with bathing and dressing. And then we have a nutritionist on staff as well. She helps with specific dietary meal planning and nutrition counseling. Another thing that I find when I am dealing with seniors is that they're not getting to their doctor's appointments. They don't have anyone to drive them. They don't drive themselves. So they just don't go. And then that starts to make their care go longer without visits. So we take care of that for them. So we provide wheelchair accessible transport to all of their medical appointments, whether it's at the Mercy Life Center or if it's a specialist that's off-site. Each van has an escort to help get them on and off the van, and it's our drivers. So it's the same one or two people on the same route, so they get to know the drivers. So they're comfortable with them, it's a friendly face that's helping them get to the appointments. And as I had mentioned, we do deliver the medications and the meals to the home. So outside of the pandemic, so before all of this happened, our adult day center portion is really fantastic. That's where our seniors come in. They get to see the doctors. They get to work out in the gym with our therapist. But then there's also groups and activities. We have dance parties, and they are in different clubs. There's monthly outings. We always have guests coming in to do different things. So we do miss having that part open. But I want to shout out our recreational therapy team because they have done a tremendous job keeping this portion of the program going, even remotely. Everything going virtual doesn't help low-income seniors. They don't have the means or the skill to go virtual. So our rec therapy team has tried to do as much of these. We still have our groups and clubs meeting on conference calls. We do conference call bingo. We're mailing activity packets weekly out to their home. So we're really trying to keep them engaged. The one thing that we recognize that their mental health is just as important as their physical health. And socialization and engagement is very important to that. So that's why I wanted to share these facts with you. These are actually from my own personal research that I've done. But 1/3 of adults aged 44 or older feel lonely, and 43% of older adults in the community are actually living in isolation. These aren't necessarily things that come up in your regular doctor's visits. The way of healthcare now, it's very quick. It's very what's going on. Okay, great. See you next time. So they don't really dive into what's going on underneath the surface that could be resulting in actual physical health issues. So social isolation can impact a person's risk of dementia, heart disease, stroke, depression, anxiety, suicide, and even increase a person's risk of premature death that rivals those of obesity and smoking. So when you think about that, that's really major. And then I wanted to share that 40% of adults 65 and older have age-associated memory impairment, and social isolation and stimulation help offer the opportunity to engage in interpersonal exchanges which can help decrease increase cognitive function. So, it is kind of one of those you use it, you lose it things. And as seniors age, they lose the people closest to them. They lose the ability to drive. They become isolated, and then they're kind of stuck in that. They don't really want to make an effort to go out. So when they get to come into the center to see their doctor, and while they're waiting to see the doctor, they end up in a game of bingo. And then they're like, you know what, I'm going to come back here 2-3 days a week. So we're looking at the light at the end of the tunnel here. We are thinking we're going to get to open up in March. We're now just working at logistically how that's going to look, how we can do it safely. But we are hoping to get to, I miss seeing them. The center is a really fun place when it's open, which brings me to this slide. And I wanted to share, you'll notice at the second to the bottom there, it says PACE enrollees are less likely to suffer depression. So studies show that 27% of new enrollments who were scored as depressed on an assessment before joining the program, 9 months later, 80% of those no longer scored as depressed. So 80% of the people that started the program with depression, 9 months later, no longer showed signs that they had it. So that's pretty amazing. And I do believe it has a lot to do with that isolation, that sense of purpose. And then the other part of this slide that I liked, this is actually from the National PACE program. Mostly everyone on this call probably has had experience with caregivers and caregiver burnout. Usually when someone ends up on my phone, they're distraught. They mom and dad needs help. They don't necessarily want to put them in a home, but they need help. A lot of times there's tears on that first phone call. So it's really rewarding for me when I can come in and say, we do care coordination. We're going to make mom and dad's appointments for you. We're going to make sure they're staying on top of their doctor's visits. And we're going to provide that transportation for them too. So you don't have to worry about it. We're going to do med management. We're going to make sure that they're taken care of to take a little bit easier off of them. When the center is open, they can come into the center, Monday through Friday. So that way that they can, have some time. So 97.5% of caregivers would recommend PACE to somebody who's in that similar situation. So these are some of our outcomes that we've noticed through our participants. Lower long-term nursing home placement rates, reduction of drug interactions, safety and fall prevention improvement. So one of our initial assessments is our physical and occupational therapist will go out to the home and they do a safety assessment. So they make sure, that this is a safe place for our participant to be. So, they will look around. If they need grab bars in the shower, we'll put grab bars in the shower. If they need a toilet seat riser, we'll put that in for them. We've even put chair glides in people's homes. So like I said, the goal is to keep them safely in the community. So we will make sure that they're able to do that. Improved symptom control and reduction in hospitalization and emergency department visits. That's one of the best things about working with the hospitals is, anyone that has worked with elders know that they have a lot of repeat offenders where they end up in the hospital a lot for things that they probably could have avoided. Our participants have 24-hour, 7-day-a-week access to our clinical team. So they can call us, instead of calling 911, they can call us and we'll triage and we'll see what's going on. So prior to my executive assistant role, I was a scheduler for home care. It was always the same people. It was always the same people ending up back in the hospital, being reopened to home care. It was like this revolving door. So our participants have less than one emergency room visit per member per year, which is that's a pretty big statistic. When you think about the elderly, these are people over 55, usually with sometimes up to 8 medical concerns, and they're only ending up in the emergency room once a year. So that's pretty great. We really help with hospital readmissions. So under Trinity Health Mid-Atlantic, which is who I work for, they actually have 4 life programs. So there is Life St. Mary that services the Bucks County and Montgomery County area. And then there's Mercy Life, which is what I'm directly a part of. We have one in Delaware County, Montgomery County, and then we personally have 2 centers in Philadelphia. One's in South Philly by Broad Street, and the other one is up by North Hancock. Delaware County is pretty unique because it is the only life center in that county, and they service all the zip codes in Delaware County. So anyone in Delaware County would be eligible for that. There is also Mercy Life West Philly. They obviously are the West Philadelphia area. And then there is also Life St. Francis, which is they serve the Wilmington area. What's neat about the PACE programs is no two PACE programs service the same area. So we don't compete with each other. So if I get a referral for someone who might be up in the Montgomery County area, we really work well together and collaboratively to make sure that the senior, gets to the center that's going to be able to help them. Currently, the only area that is not being helped does not have a life center is Chester County. I do believe there is a conversation happening so that we do get a life center for the Chester County area. They currently do not have one. We also do life programs for some of the different religious communities. So there's several convents that we have set up life centers on the convent. So that way we help the sisters there. And then we also have a center, it's called Valley View, and it is in Elwyn. It's actually part of Elwyn. It's on their property. And our residents live there. And what that is it is for strictly hearing and speaking impaired. So they have to be fully hearing impaired, and then they can live on the property, and they do have to pay rent, but otherwise all of the life program services are available to them. And everybody who works there is ASL certified. Actually, a lot of the employees that work there are hearing impaired themselves. So it's a pretty special location, and that's in the Media Elwyn area. So the eligibility requirements for somebody to be able to join Mercy Life are they do have to be 55 years and older, which is nice. It's a little younger than the traditional 65 for programs for seniors. Live in one of the PACE service areas. We do need to make sure that they require the level of care that we provide. So to do that, we will have the local area agency on aging do a third-party assessment. So they look mostly at activities of daily living, make sure that they do require the quality, the level of care that we provide. Then we also have to make sure that they are financially eligible. So it's roughly about $2,349 of monthly income, and then no more than $8,000 in total assets. That does not include a home or a car, but it does include any cash value that would be available for life insurance policies. But we go into all of that with them. And then again, like I mentioned, they have to be able to live safely in the community. So the people we serve, should be able to stay independently at home. If they are not able to, we usually will direct them to a different program option. This is what our enrollment process looks like. So if somebody is interested, it usually starts with me as the community liaison. I will talk to the applicant or the family, and we'll just go over some of those things I mentioned in the last slide. Make sure that they might be appropriate for the program. We're a little specific. So I find that sometimes I'm talking to people, we just don't have the resources for them. For instance, I had a woman yesterday, her cousin has a really, really horrible disease. He needs all day care and night. We're not the program for them. So I try to stay really connected to different resources so that I can at least guide them somewhere that I think will be, better suited to them. Honestly, the best thing about this past year, even though it's been rough for all of us, I've done so much networking in the elder care community. And it's really special because everyone cares more about the senior and the senior getting the appropriate, correct care for them than they do their own numbers. So it's been really rewarding to be part of that network. And I just am building up my resource list. So when someone calls and I can tell we're not the program for them, I can easily direct them to somebody that might be. So if it looks like Mercy Life might be a good fit, my enrollment specialist will come in. She's wonderful. Each county has a different enrollment specialist. They do the initial intake, make sure everything looks right. And then anyone who has any experience with a Medicaid application knows it's a nightmare. So we take care of that for them. So we do have to apply for Medicaid, but we do it for them. So they sign a release and then we deal with the banks. We get the financial statements. We put them out to the county assistant's office. And then while all of this is going on, I schedule that assessment with the area agency on aging. So once we know that they're financially eligible, they're medically eligible, then they meet with that interdisciplinary team. They will do the assessment, make sure that they are appropriate for the program, make sure that they can live safely in the community, that we do have the resources to serve them. And then they will come up with the initial personalized care plan. And we do all of our enrollments on the first of the month. So for instance, right now, if I was to meet somebody, this all takes about 2 to 3 weeks, because we are at the mercy of the banks. We're at the mercy of the area agency on aging. So it can take about 2 to 3 weeks time. So if we got a referral today, they'd be looking at an April 1st enrollment. So I do work very closely with Mercy Home Health, or a home health agency of the person's choice, because if they're being discharged from a rehab or a hospital, a month might be a long time. So a lot of times we'll bring home care in. Home care will make sure that they are taken care of. When the first comes, it's a very easy transition. They discharge out, and then we come in, and then the person is provided continuing care. So I've been talking a lot. I've never played a video on this before, so I wonder if this is going to work. This is Bob. I was worried about that. So this is a great video because it shows from the perspective of a actual Mercy Life participant. Except it's not going to work.
My name is Bob Grosso. I'm 64 years old, and I'm a participant in the Life program.
Oh, here it is. All right, this is Bob.
Every day, Mercy Life helps me to be independent, active, and healthy. I start my day each morning with my home care aide. She comes to my house and helps me get ready for the day. Sometimes I have trouble putting on my shoes or buttoning my shirt. My aide helps me with that. Around 9 o'clock, the light van picks me up and takes me to the center. It's nice to have free transportation every day. The driver is nice, and I enjoy talking to the other life participants on the ride. When I get to the center, I'm always greeted with a smile from the staff. They're very, very friendly. First, I go to the dining room. I join my friends for breakfast. They always have a variety of foods to offer, and the dietitians here make sure I eat healthy foods. After breakfast, I go to the clinic in the center and meet with my nurse. She's one of my best friends, especially at the center. She understands my needs. If I need refills on my medications, I can do that here too. I fractured my hip not too long ago, and I wasn't able to stand on my legs. Before I started with Mercy Life, I couldn't go up the stairs at all. And now I'm walking up and down the stairs every day. So that's a lot of improvement on my part. After my therapy, I'm in the mood for some fun. So I'm usually cards, playing bingo, or even dancing. I'm able to get all the care I need in one place at Mercy Life. To top it all off, I'm able to continue living at home independently. Mercy Life has changed my life.
And I just wanted to end by talking a little bit about the pandemic and how we've pivoted our model of care. So outside of the day center portion, the adult day center portion, everything has remained the same. So our clinic has always remained open. The centers are open. It's just the day portion is not operable because we have to protect our most vulnerable population. But all of the care has remained the same. So we've upped our home care a little bit. So the therapists and nurses have gone to the home, but our participants are still coming into the center. We are doing a little bit more meals in the home now. I had mentioned the rec therapy team doing things in the home, but everything else that I had mentioned outside of the adult day center portion is still operable. So it's great. We did miss a beat. It's been really impressive to watch our leadership team and the center team really jump at the opportunity to pivot and make sure our seniors are still well taken care of. And that is Mercy Life. So any questions or anything anyone has?
Hey, Kate, it's Paul Firestein. We talked a few weeks ago.
Hello.
So I'm from St. Vincent de Paul here in Delaware County. And a question I have is when we have families that we're helping, some of them may have a chronic medical condition that this could be a adjunct for their primary care, but because the condition they have leaves them impaired, they certainly could benefit from transportation to their doctor's appointments, certainly meal help when they've been at the doctor all day and don't get home until 5 or 5:30, that sort of thing. but they don't fit necessarily the classic elderly. It's because of an underlying condition. And so I'm just trying to determine in my mind if this could potentially be a good solution for them.
Thank you for the question. So there's two parts to that. One, because our primary care physician, like I said, we see them once a month and they can come in and see the doctor the same day. They do have to come to our primary care physician. So I open with that usually when I'm speaking with a participant, make sure that they're aware of that. And then because of the fact that the Area Agency on Aging needs to determine that they need our level of care, it can be tricky. So if they don't have a lot of issues with their activities of daily living, if they can, a lot of times they might not be eligible, but I will work with each person to really find out, because, I'll talk to someone, they're like, oh, well, I'm fine. Well, how can you get in and out of the shower okay? They're like, oh, by myself. I was like, do you use a grab bar? And they go, oh, well, yeah. I was like, so you're not really doing it yourself. You do need assistance. So the more I kind of dive in with some people, I find out that they actually would be appropriate. They themselves are just seeing themselves as like more independent than they actually are. So I'll just kind of coach them, to what the questions are going to look like from Area Agency on Aging, and urge them to answer them as honestly and as vulnerably as possible. On your worst day, could you use help with these things? But Paul, also good to know is that the Area Agency on Aging usually can connect people with community transit. So that's something that they can just kind of hook up with, or Meals on Wheels. So, those are available also through Area Agency on Aging. So if they might not need, the full spectrum of care for life, those two services are still available.
Okay, great, Kate. And I should have said from the onset, great job. This is super helpful. And I'm sure I speak on behalf of all of us. Thank you for what you're doing. It's a wonderful, wonderful service.
Thank you. I agree. So I'm glad people know about it now.
Well, with your kind permission, I have a question. First, thank you, Kate, for this wonderful information, and thank everybody for being here, who are showing their interest in the fact that this is an area that in many ways is underserved by the community, underserved by maybe some government bureaucrats. But the question is, I'm Jerry Gonzalez from Child Guidance Resource Centers. Many of the seniors that we work with are either living with their extended family or maybe taking a leadership role in their extended family. Does that have an effect on their qualifications for services from Mercy Life? If they are providing a service, if they're providing, or if they're just living with their family, or if they are maybe the primary role in the family?
No, it doesn't at all. And that's a great question. So we actually love when there's family support. A lot of the people I work with, they have no one, and that makes it challenging. When there is family support, it's great because we get to work together to provide that care. When we're looking at financials, we are looking at the person's financials. So even if they live, with their son and daughter who are very well off, that doesn't matter to us. We are looking at that person's overall total assets and that person's monthly income. The only time that comes into play is if the person is married. If the person is married and the husband is applying, we will look at his monthly income, not hers, but we will look at the total assets collectively. So if somebody is married, it is the couple's total assets that will still, and it's 16,000 instead of the 8,000.
Thank you so much.
Yeah, thank you for the question.
Kate, I have a question.
Yes.
In normal times, if someone lives in a zip code where there's a life center, is transportation provided to and from that center?
Yes. Oh, absolutely.
Okay.
And then to any other additional medical appointments they have. So, they'll come into the center to see their primary doctor, their therapist. But if they have to go see their cardiologist and it's at a different location, we will provide transportation from their home to the doctor and back as well. So any medical appointments, transportation is provided for them.
Thank you.
Yes. Oh, I have a question, please.
Sure.
Yeah, and I'm so sorry that I came in about 15 minutes late, and forgive me if you already addressed this, but I just want to know the answer. Are your people required to attend your day program when it's functioning?
No, and that's a great question. They are not at all. So that is an absolutely optional program. They can come in never. They can come in once a week, twice a week, 3 times, up to 5 a week. They do not have to come in. The only stipulation is they do have to come see our doctor once a month. And I had mentioned that because we want to make sure we keep eyes on them once a month. So the only time they have to come in is once a month. But what I'll do is I'll try to schedule those appointments on a day. If I know somebody likes arts and crafts, I'll schedule their doctor's appointments on arts and crafts day. Because then they'll come in, they'll wait for the doctor, they'll start, coloring something. They'll be like, I'm going to come in once every couple weeks. So people, I think, sometimes need some coaxing into enjoying the day center portion, but that's completely optional. That is as much of it as you want to make it.
Good, thank you.
Mhm.
And Kate, if somebody is interested in finding out more information, I have provided your email and contact information in our newsletter for today, and I can always send it out as a follow-up as well.
Thank you so much. I appreciate that. And all of that is my direct information. So it'll come right to my cell phone or my email.
Fantastic. And I know that some people were even curious about your slides, whether or not they can be shared. We can certainly share the video with everyone.
Oh, great. Excellent. And most of the information I used in the slides, I actually have available on PDFs. So I can also share that as well.
Great. Do we have any more questions for Kate?
I have a question. You mentioned that your participants need to use the primary care doctor at Life. What about their other doctors? If they have cardiologists or others that they have relationships, can they continue to see those types of doctors?
So that's a good question. So in our center, we provide primary care, dental, vision, hearing, and podiatry. So those doctors, they will see our doctors because it's all done in the center, which makes it very easy for them. It's coming to the same place. They can see their doctors in the same day, if that's available. But all of their specialists, neurology, cardiology, oncology, all of that we do not provide. So if it's within our specialty network, and it is very extensive, we're connected with pretty much all of the major hospital systems in the area. So the odds are in the favor they will be able to keep their doctor. If it's not, so for instance, I'm working with a woman right now, she doesn't speak English, her oncology team is important to her, and they speak the same language as her, they're technically not in our network. So we're working on getting a single contract agreement with that care provider so that they will still be able to keep them. So there's ways that we can work around it if it seems really fruitful for the participant and for us to take them on. We'll kind of work to help to keep their specialists.
And one more question: if someone is not Medicaid eligible, can they be a participant in the Life program under private pay?
They are able to. It's very high.
Okay.
So it's close to $4,000 to $5,000 a month. So it is pretty high up there. What we have done is if people are a little over for total assets, if they have 12,000, 13,000, but they really see the value in the Life program, they will do private pay to help spend down. And then once they get under that $8,000 cap, we apply for the Medicaid. So we can do that as well. We'll work with people for different ways to spend down. If they're like, well, I don't even need this. What am I doing with this $5,000? I'd rather get all my medical services for free, and my quality of life will improve. So we're kind of work with them if that's something that they're interested in.
Okay, great. Thank you.
No problem.
I may have missed this and I apologize. So you only accept Medicaid, not Medicare? I'm so sorry if you said it earlier. I had to step away.
Oh, no, I didn't. So we will accept both. So you can be dual eligible, but Medicare isn't really necessary. Medicaid is because our service population is the low income seniors. They do have to be financially eligible for Medicaid, but they can also have Medicare. But they can be dual eligible, but the Medicare is not a necessity.
Okay, but if they have Medicare and they're qualified, you'll take your payment from Medicare.
Yeah, so then we get dually, then we get the payment from both of them.
Okay.
Do we have any more questions for Kate? This has been very informative and certainly a lot of engaging questions as well. It's very helpful. Okay, well, Kate, thank you so much for joining us today, and we will definitely follow up with sharing more information in the email. And now I guess I'll give the floor to some of our healthcare professionals that are also on here with us today to share a little bit of information about what they do. And people that are on the call listening, you can ask questions if you would like. Let's start with Beth Adams. I'd love to hear a little bit about how Simpson Meadows is doing and also your little special project that you're always working on so diligently.
Thanks, Heather.
Sure.
Simpson Meadows, I'm the community outreach representative for Simpson Meadows, which is a senior care community located in the heart of Downingtown. We have independent living, assisted living, and memory care. We do not have a skilled unit. And it's just a lovely place. If, when things open up and you can come and visit, we'd love to have you come. It's been there for 20 years, kind of a hidden gem. A lot of people don't know it's there, but just a lovely place, very home-like, and great residents. And what Heather was alluding to in terms of my special project is I founded Petals Please, which is a nonprofit. Basically what we do is we take donated flowers from weddings, funerals, corporate events, anytime the flowers would be discarded. They end up in the dumpster or freezing on a grave site. We rescue those flowers, we take them apart, create small bouquets, and we gift them to residents of senior care communities, Meals on Wheels, food banks. We're not limited, but most of what we've done has gone to our elders who, especially at this time, have been so isolated and oftentimes lonely. So to receive a bouquet that says, "We care about you, we're thinking about you," just means so much.
Thank you so much. I just love it. I love it any more than I do.
Oh, thank you.
Wonderful. Thank you. Does anybody have any questions for Beth? And Beth, I'm going to include your contact information as well. I'll include it in my follow-up email because I think that,
Sure.
I do have a question. Beth, what is there like stipulation? Like, how does someone go around getting the Petals Please?
How do they end up receiving them? As we just keep a list of communities that we've worked with. We have about 75, primarily in Chester County, but we do go into Delaware County. We do go a little bit into Montgomery County, Lancaster County. Really it's just, we're not limited. So if it's not too far a distance that our volunteers would, be willing to drive to, then we're willing to go. So if you know of somebody that you think would like that sort of thing, you can just reach out to me and we could put them on our list as a potential recipient. We'd love to do that. We've done over 20,000 bouquets in the last 2 years.
Wow.
Amazing.
How's it been through the pandemic since a lot of things aren't happening?
Yeah, that's an interesting question. So we have scaled back a little bit for 2 reasons: that the donations obviously aren't as abundant as they once were, but also out of safety concerns for our volunteers. But you'd be surprised, like we just recently got an enormous wedding donation. The bride had planned on a 300 plus wedding in Center City, but scaled it down to 30 people in Chester County. But she wanted to support her florist. So she continued with all of the flowers that she had originally ordered, and then they donated them all to us. So, for Valentine's Day, we put out over 300 bouquets. For Christmas, we did the same. So, funerals where we would get 25 big arrangements, now maybe we'll get 3 or 4. But it's amazing how generous people are. And the more people that know of us, the more people want to contribute. So we're doing okay.
Thank you, Beth.
Mm-hmm.
Okay, well, and like I said, I'll include Beth's information. How about we hear from David? Oh.
There we go. Hi, everyone. Great presentations. I really enjoyed them both. I am the client care coordinator for Senior Transition Services. And basically how we help the elderly is we move them in when they need to move into a community. We will go in for a complimentary consultation, assess their needs in a very compassionate way, because that's a very stressful time for an older person to be leaving their home of 40, 50 years. So we just look it over, we decide what they can keep and take with them. We create the floor plan that they're moving to. And then we help them with the discarding, downsizing, and donation. So that's what we do. And it's just one more thing that we can provide, and everyone else provides a certain thing for the elderly. So we feel very compassionate about it, and be glad to help anyone that's out there that needs our services.
Thank you, David. And
Thanks.
actually, Marlene Stubbs, the
No.
president, is going to be our speaker for our next coffee chat. And the topic is going to be the emotional side of downsizing. So stay tuned if you're interested in learning more about the services and getting learning some tips and some tools for moving ahead with anything like that. That will be on our next coffee chat on March 10th. So we'll be sending out some information in our email about that as well. Thank you, David.
Sure.
Jeannie, are you available? I don't see your picture on here right now. Well, we'll come back to Jeannie. Let's see who else we have on here. How about Tim Ziegler?
Thank you, Heather. Tim Ziegler with Camelot Auction House. We also help seniors when they're in an emotional time and they're downsizing. And the emotion is often in the things that they've had for many years. They're often moving from a home where they've raised their family and moving to something much, much smaller. Senior transitions and companies like that can help them identify how much they need to take and deal with a whole lot of their emotional matters, but a lot of it's tied up in the item. So we help them to understand what's valuable in today's market. The most remarkable thing that I've found that in more often than not, the top 4 or 5 items are worth more than everything else combined, at least to be sold. And the client rarely knows which items those are. They sometimes do, but more often than not, they don't. So we help them during that time and then offer the items that have significant value through our upscale auctions at Camelot Auction House. So my information's in the chat. I would be happy to talk with anybody who has someone in that situation. We're just talking general about how we work. Thank you. Thank you very much, Heather.
Thank you so much, Tim. I appreciate your insight. Let's see who else we have on here. How about Doug?
Hey, good afternoon, everybody. Great presentation, Kate. I love the life programs, and in my prior work, I worked a lot with Life St. Mary, so I love the life programs. As many of you guys know, I am in the midst of a transition career-wise at the moment. So yes, still looking to land in the IT world ultimately, but I'm actually currently helping folks kind of get online reviews. Everybody is, looking for referrals. Obviously, a group like this is great for referrals, but many people ask for personal referrals. But interesting enough, when you go online, people trust the online reviews even over a personal reference for businesses. So if you have a service business, Linker is a service that actually helps you get online reviews quickly. Right after you finish working with the client, you finish the sale or whatever job, you can send them a text message with a link right to, you can review on Facebook, Google, Yelp, Zillow, just quickly and easily, can be done in like 30 seconds, and you've got a great online review. So if you're looking for help with getting more online reviews, let me know. I put my contact info in the chat. So it's good seeing everybody.
Fantastic. Thank you, Doug.
Sure.
And Kristen. See if I can.
All right, there I am. Hi, everybody. I'm Kristen Swanek with AmRamp. We do accessibility products such as modular ramps when somebody's trying to get in and out of their house, portable ramps, stair lifts, grab bars, different kinds of lifts, really anything to make your home accessible. And I wanted to say thank you, Kate. I appreciated your presentation. We have worked with some of your social workers and your families, and they're really great. The social workers that we worked with are over the top. They really seem to care about, the people that they're working with and really go the extra mile. So I'm familiar with your program, and I've told people about it as well. So highly recommend it. Great program. Thank you.
Thank you, Kristen. I appreciate that. How about Bob?
Got to find the unmute button there for a second. Sorry about that. Sorry, Bob Batchelor, Flying Angels. We're the guys that have the doctors and nurses who fly people around the country and around the world on commercial airlines.
Fantastic. And where is your most recent destination, Bob? We're always curious about where you've been traveling to.
Second. Let's see. I was actually in Bangalore, India over the weekend.
Oh my gosh!
So
wow.
that was my let's see, second trip to India since the pandemic started. And what I loved about this particular trip is this was actually my first international trip post vaccine. So it was really it was so much more relaxing. One of the fears that I have had and my team has had is having something go bad while you're overseas, having developing a fever or getting sick while you're overseas. So we've really been limiting the time we're out of country. So it was just nice to not have to really sweat it.
Oh, well, I'm so glad to hear that. Good for you.
Mhm.
And if you don't know Bob, and you get to know him on some of our coffee chats, he is known for his signature hat. So thank you, Bob. And who else do we have in here? How about here? Jana, would you like to share some information too? Can you unmute yourself? Sorry, it's not allowing me.
Okay, technology. So, I can't do that. Oh, I just turned it off.
Okay.
Hold on, let me see. Can you guys hear me this way?
Yes, yes.
Okay, wonderful. So I've got Annette Wilson here with me as well. We're from the Landing of Towmenson. So we were trying to do a conference call in the same room, but it is what it is. So we are Lansdale's, one of Lansdale's newest senior living memory care communities right near the Lansdale exit of the Turnpike. We have senior living, personal care, and memory care here, and we are open for tours. So if you know anybody that's looking, we've partnered up with David and a couple other folks here on the call. Love to just network with folks, find out ways that we can best support our families during this really trying time, and looking to just get back to where we were several months ago, and just keep continuing those relationships and growing them stronger. So it's great to see everybody. Great presentation, by the way, too.
Thank you so much. And I still have my special ornament that some of your seniors made for me. I love it.
That's awesome. It was actually our folks that have dementia that put that together. They made glass sun catchers for our guests. So that's wonderful. Thanks, Heather.
Your Opal community. Isn't that what you call
our Opal community? Yep.
I love it. Thank you.
You got it. That's special.
Sure. Dana from Longevity.
Hello, how are you today? It's so good I haven't been on many of these, but it's so good to see other people, and I can't wait to see people in person. But I work with Longevity Income Solutions. They provide elder care financial solutions, and they do so much more, but they specialize in elder care, as I had mentioned, and really planning the financial decisions and being able to, I like to say, to pivot when your situation changes, your medical condition changes, your just really, we all deal with it really in crisis. So they like to say it's never too late to plan, because even if you're in crisis, they can still help out, and they do so much more. They really get involved with the families, and they guide you and direct you. And I can speak from personal experience. They've been a godsend to me and my parents, and now my mom. So they've really been able to steer us in the right direction. And when my dad passed, they were able to jump right in and take care of all the finances and really pivot with the changes in the monthly income and guide us on what to do next. And so I can speak highly because I've used their services, and we still do.
Absolutely. Thank you. They've helped out some of our clients as well. Absolutely. How about Sheila? Sheila, if you want to unmute yourself.
Am I unmuted?
Okay, yes, yes.
Well, I was just on as a guest, but
oh, I'm sorry. I thought you were representing someone.
I am representing. I'm here on behalf of our state representative, Regina Young, in 185th District, in which I am the constituent service advisor for Sharon Hill, Kawin, and Darby Township 1 and 2. So I would like to say that all the information that you ladies and gentlemen have presented to us is very helpful. We're a new office, just opening up. So it's great to see that we have so many providers out there providing these services.
Well, fantastic. And Sheila, I will tell you that any one of the providers on this call would be happy to give a moment, to talk with you, share more information. And I find that our community really joins together and just loves to support each other. So I think you'll find that to be true. And thank you for joining us today. Sounds like a treat to have you on here. Who else do we have? I'm not sure. Is there anybody else that would like to share any information that I did not call upon? Okay.
Well, with your kind permission, this is my first time here.
Yes, yes.
And it is very, very exciting. Once again, I'm Jerry Gonzalez from Child Guidance Resource Centers. And I like to connect with agencies and organizations that work with seniors, because so many of our families have seniors as in their homes, as maybe a parent or a guardian or a caregiver. And we are often involved with many organizations like yours and do a lot of community work like you. And when there's no pandemic, we're in the community sharing information. We do mental health, behavioral health, and prevention services in Delaware County. Prevention and recovery has been hit hard by the pandemic, because a lot of folks aren't seeing their sponsors, not meeting their recovery folks. So we want to be involved with mental health, behavioral health, and recovery. And with your kind permission, I'll send you some information about a quarterly resource network called Delco Area Resource Network, or DARN. We quarterly, and so many of you may have already been there. We do a wide variety of services, not just children, but we do services for the aged, services for recovery, services for any agency who wants to come share and network. We have a quarterly meeting. So, well, if your information's in, well, my information's in there. If you want information about DARN, please send me an email, and I'll be more than happy to send you information about that.
Well, perfect. And Gary, I am more than happy if you would like to shoot me an email after our call today. If you want to send me that information and your information, I'm happy to include it in the follow-up email as well.
Great. I have yours. I'm sure I do somewhere.
Oh, absolutely. From the reminder for today.
Great. I have it. Thank you so much.
Sure. So is there anybody else that I did not call on that would like to share any information about the services that they provide, or any tips or any other new information they want to share? Okay, well, I guess we're good then with our call for today. I will tell you, we have one of our top discussions that we have and presentations that we offer is getting your affairs in order. And our next one will be March the 18th. So if you're interested in that, be on the lookout. In my follow-up email, some more information will be in there about that. And if you would like to sign up for its 1-hour presentation, it is open for anyone. We always love to be a resource to everyone. If you have any questions anytime for Elder Care Attorney Rob Slutsky, feel free to reach out to me, or you can reach out to Rob directly yourself. And we're just happy to be a part of the community. So thanks so much. And thank you again, Kate. You did a wonderful job with telling us about Mercy Life. I think everybody on this call today learned a lot. So thank you again for your time today. And happy Wednesday, everybody.
Thank you
for the
to
rest
all.
of the day. We'll be in touch. Our next coffee chat will be the 10th of March. Bye-bye. Thank you.
Thank you.